So, well, hello. So, Nicole is a dietitian with me in Have Your Cake Nutrition and Wellness. And she is a certified diabetes educator, which I know that name changed, and I can't for the life of me tell you what the current name is, but um, there
Yeah,
you are.
got it. It's CDCES. It's like Certified Diabetes Educate. I honestly don't know a lot of.
They change things so frequently, it's really hard to stay up with the current
Yeah,
stuff. Um, anyway, so I wanted to talk about gestational diabetes because Nicole is the guru and kind of like share I'm 7 months pregnant, PS, and just share my experience of like what the test was like this time around and what tests I did and all of the feelings that kind of came with it and how intuitive eating comes in there. And so yeah, I just figured this would be a really good topic. So
definitely.
yeah,
Perfect. Yeah.
yeah. So I guess let's start with like just saying like what is gestational diabetes for like people that don't know.
Yeah, so gestational diabetes is diabetes that's first recognized in pregnancy. And in all pregnancies, we see some insulin resistance, and this is natural. This is supposed to happen in the history of pregnancy. And we do notice that we start to see blood sugar rise for women around 28 weeks, which is why that's usually when your provider will suggest having a glucose test done. But the reason this is happening is the placental hormones are really strong and are affecting many things in pregnancy. And one is insulin resistance. And the reason being is that, especially later in pregnancy, this having insulin resistance in the body helps shunt glucose or sugar to the baby for growth. Um, and for some of us that are uh, have maybe a predisposition to diabetes. This could be like a family history. Um, One risk factor is like if you have a pregnancy over the age of 25, which right, so at least
Which is everybody. I should say everybody, which is like I feel like a large
yeah, so
amount of the population.
one risk factor at least. And then again, if it runs in families, if um, what else, race can play a role in this as well. Um, yeah. So it's quite common. It's about 8% of pregnancies. But again, this is naturally occurring in all pregnancies. It's just for some of us when the placental hormones peak and insulin resistance starts to raise, our blood sugar kind of teeters over where we'd like to see it for quote unquote ideal outcomes for pregnancy. So
Yeah, yeah.
five reading around 28 weeks.
Yeah, so 28 weeks is when the doctors or whoever your healthcare providers are telling you that you have to now go and do this, drink this terrible orange solution,
Yep.
and get your blood sugars checked. So, and I know like every country does it a bit differently, but in the United States, we're doing the two-step process. So typically, right, everybody is following like the same path. Do you want to explain like the two-step process a little bit?
Yeah, so this one seems to be the most common from areas that I've worked, in the country, and just from the clinics and providers that I work with here. And we're based in Massachusetts, by the way. So this is what we tend to see. So the two-step process is going to be it's a non-fasting test. So you can eat breakfast before. Oftentimes you'll have an appointment with the lab like mid-morning, midday. And you go in basically and you drink a solution of 50 milligram 50
50, yeah, the 50 grams.
yeah
Ugh, gross.
50 grams of glucose in a solution, which is usually like orange flavor. Some women actually get the bottle to take home and do it at home and then drive to the lab. When I've done it, I've always had to do it there. You drink the solution, which I think is 6 or 8 ounces.
Yeah, it's tight. It's tiny. I don't think it's more than 8 ounces.
Yeah. The hardest part for me is that you have to finish it in 5 minutes, which that was I felt like I was just kind of chugging, and with how sweet it is,
Mm-hmm.
it's kind of like little bit of a thicker, like flat soda, basically.
Yep.
And so then you sit for an hour. You're not really supposed to move around. You're technically not supposed to even drink water, which I'm not really clear on why. It depends.
Yeah.
You get different directions from your lab, from your provider. It varies a little bit from my experience and just talking to a lot of people. But then you sit, and then they take your glucose. And based on that, you either quote unquote, pass or fail, which I hate those words, but that's what you will hear. And fail just means, we're a little bit over the range usually. And then that second step, if that does happen, they bring you back.
And so what the number is 140, right? 140 is like the magic number, right? That they use of that pass or fail.
Yep. And even if it's like a couple over, you're generally going to come back for like the second part of the test, which is why they call it the two-step process. And that's a fasting test. It takes 3 hours. They take your blood right when you get in, and then an hour later, and then 2 hours later. So most people end up doing that second process. Other people, if their blood sugar is much higher, or if they've had gestational diabetes in the past, they'll just skip it. And they'll usually come into a clinic and just start to be managed. But there's other options, which Kathleen, you've experimented.
I've guinea pigged myself for this pregnancy, for better or for worse, and I've been experimenting. And so this is my third pregnancy. I did the typical two-step process with my other two. First go around was fine. Very different with your first pregnancy, though. Younger, you have nothing else going on in life. I shouldn't say that, but it was much more controlled. I didn't have other children to care for at that point. And so then second time around, wasn't expecting anything, but it was just harder to logistically get into the lab, and I felt like I had to. I couldn't get there first thing for it to be fasting, and anyway, so it was later on. I think normally it's 28 weeks when you get it, but I really think I was probably closer to 32 weeks by the time I was going through like my first step with my second pregnancy, and I failed by like 3 points, and I have to say I cried. Like, regardless of my knowledge as a dietitian, and obviously, I know that the placenta is really controlling the show at this point, but there were just so many feelings that came in to that. And which is again why I wanted to talk about this. And so then anyway, so I had to go through the the 3 hour process, which was awful. And I never want to do it again. I felt so terrible from that. And then for my experience in the second pregnancy, then it was fine. I passed and everything was good. So fast forward to today, third pregnancy. I don't want to do it. I just didn't want to do it. So I was exploring all of the other options, right? And there actually is a lot of options that I don't think we're told about, right? You have alternatives to the glucose solution that you could do, like 28 jelly beans, which is the same amount of sugar, right? I would personally much rather eat 28 jelly beans than have to drink that terribly flat soda.
I think how many people the drink, I feel like, bothers. They'll either vomit, they'll have morning sickness at this point. Like that right there, just keeping it down, I think, is a big issue for some people. Jelly beans would probably be okay.
Yeah, I mean, I would bet most people could eat 28 jelly beans, like no issue. So, for the majority. But anyway, so that's an option. I'm seeing a midwife practice this time who was fine with like a smoothie, and so like anyway, there were all these alternatives to this glucose solution, and I still, for whatever reason, didn't want to do it. I felt very resistant about the whole process. And I think that, if I'm being completely honest, it's because I have expectations, right? I'm a type A I'm a type A person. I have a quote unquote like right way of doing things. And so with my first pregnancy, I woke up, didn't eat anything. I went to the lab, I got my blood done. Boom, I was fasting. So this time around, I'm not going till the afternoon. I have a crazy day with the kids. I don't want to think about what I'm eating that like during the day whatsoever to set me up to quote unquote like pass this test, right? I was just felt very resistant. I didn't want to do it at all. So I opted to do blood sugar test at home, which is what option what are we option like number 3 now at this point of like what you could potentially do. And so I did my fasting. I woke up, I did my fasting blood sugar, and then I did an hour after each meal. So like breakfast, lunch, dinner, an hour. And I did this for a week. And so in my mind, I don't have to go anywhere. I don't have to worry about childcare. I don't have, like there was just it just felt logistically better to me
Mm-hmm.
at my stage. And I was like, and also part of me was like, oh, this will be a great experiment. Like the sciencey nerd in me thought that this would be kind of fun. So then I actually was doing this and I was not prepared for the emotional component that came with this. Of actually like seeing numbers, seeing how my body like reacted to certain things. Because again, I think that we work with a lot with intuitive eating and going through, step one is like rejecting diets and all that stuff and really making peace with food. And so if I really got down to it, seeing those numbers started to put me mentally in the like good food, bad food category. And I was like, you can't tell me that. So I found it so emotional that to be doing this process.
Mm-hmm. Absolutely. I think that's really a common experience. So I mean, it's really important when we are working with people, or if you're someone who is experiencing a pregnancy, working with a provider who is asking questions about your history with your body, because this is pregnancy is in general, but having
Yeah.
managed a gestational diabetes diagnosis, you should be working with someone asking and screening for disordered eating, asking if that's in your past, so they're ready to support you, because it is such a triggering time. Even if you have any of that in your past and suddenly you're having all these feelings and you're starting to maybe restrict food a little bit, or those are big red flags that we need to talk about it, because again, you're not the only one. It's that's probably the majority of people would feel that way, I would imagine.
Yeah, I think it's so common. I think that the stigma around this diagnosis is huge. Again, like, even though I mentally know, if I was diagnosed with gestational diabetes, it's not because I've done anything, right? It's like truly the placenta is in charge of this show right now. However, because of how it is stigmatized, you can't help but bring it back on yourself and blame yourself. Well, I was eating wrong, quote unquote, like wrong. Like I was eating a wrong way, and so then I caused this. Or I think, for subsequent births, right? If this isn't your first, if this is, how, a subsequent birth, your body's different at that point. I'm larger than I was with my first pregnancy, and so then your mind just starts to go, well, I'm in a larger body now, so that caused it, So it's hard not to go into this internal, blame game.
Yeah, absolutely. You're not the only one. I oftentimes, the first time I'll see someone, I work also at an area hospital where we have a gestational diabetes clinic. And a lot of people are coming in eating too little, actually. Usually the first is trying to pull some of these carbohydrate foods specifically back in, just because it's well, it's, probably not healthy for the majority of their pregnancy or the rest of their pregnancy. So it's usually kind of pulling people back in. So at that point, they've had maybe a week to like try to figure this out on their own. And that's a really hard time. I couldn't, um, so it's that, but then there's also the question, I've been eating a lot of ice cream in this pregnancy. Did that cause it? So it really is, we just like look to like, what could we have done differently?
We look to the blame game, and I think that really stems from like diet culture that we're surrounded by, the whole like societal expectations around like body norms and food norms and all of that kind of stuff. So it's hard, it's hard not to play that blame game, and I know you see this all of the time with the work that you do, how you're diagnosed with gestational diabetes and then, okay, all the carbs have to go. The only way to manage this is with food restriction.
Mm-hmm.
But there's so many other things involved in impacting blood sugar.
Yeah. And yeah, can lifestyle play a role for most of us? Sure. Is that okay to try some things before jumping to medications or something? Of course. But at the same time, at least in our clinic, about 50% of women we see by the end of pregnancy need some form of insulin, whether that be NPH, like an insulin that's going to help their blood sugar overall, or mealtime insulin to help them cover the amount of carbohydrate they're eating. And that's regardless of what they do. So you could be doing one thing at, 29 weeks that works well to keep you quote unquote diet controlled.
Mm-hmm.
And by 33 weeks, 34 weeks, that's kind of not, again, like working. Or we're seeing blood sugars rise despite doing the same exact thing. And it's really the surge of placental hormones that we have no control over whatsoever. So I think that makes it difficult for a lot of people. But just knowing that, medication is, especially for diabetes, is there's a big stigma around that. Like, oh, you could have done lifestyle, or it's looked at it like a lifestyle condition. When it's really not. I think lifestyle probably, I forget. I know I've heard like a quote that it makes up like 5% of the overall pie of what's going on. A lot of it's genetics and hormonal, and we don't have control over that, but we're led to believe that we have control over like 95% of, what our experience is. And it's just not true. And that's really damaging to people because we're resistant to medication. We feel like a failure to be on a medication when really, especially with, in the case of insulin is a hormone our body's already making, right? That's the hormone that helps transport sugar from your bloodstream into the cells of your body where it's used for energy. We have insulin working in our body. When we take insulin with any form of diabetes, we're supplementing what our body is already producing. So I always compare it to, I have a thyroid condition, I have to take thyroid medication. I have no control over that. And that's really mimicking what my thyroid should be doing. Yet there's not a stigma around that, right? So
right.
Really, it's just helping supplement the body essentially to keep the blood sugars in a great, a range that is associated with less complications in pregnancy. And a lot of the times it's nice. It almost feels like I think of it as a good thing for a lot of women because they'll be controlling the food so much, and then it gets to the point where that's still not, quote unquote working. So we need insulin. And then there's just like this breath, there's like room to like eat a piece of fruit for a snack and not feel like you're doing damage or.
So many comments to this. Like, I feel like there's so many directions. So first, I think that when we're kind of talking about, this and kind of planning it, you brought up a great point of like commercials for diabetes medications, and what we see in the media, because the media really does drive a lot of these thoughts that we have in our heads. Right. And so if you think about the media, like commercials for insulin or whatever diabetes medication there is, it's always it's touted as a, like you said, a lifestyle um, ill, a lifestyle disease. Meaning, which right there, that those words, that's making it sound like it's putting it back on you of like, well, you can control this, right? Which we know is just really not true. Because there's so many things that kind of come into this. But then the other piece is like if you look at the body types of everybody in those commercials, it's all people in larger bodies. So again, it's stigmatizing this diagnosis as only affecting, people in larger bodies, which again, that's not true. That is not true. That is not accurate. But that is what the perception is of gestational diabetes, regular diabetes, whatever, that everybody's coming to the table with. So, I mean, I think that is just the media. Oh, that's a whole like conversation in itself. But then, the other point was the medication stigma. It reminds me of stigma around childbirth itself. Like I think there's a stigma around for some people around like natural childbirth versus like getting an epidural, and like if you have natural childbirth without an epidural, somehow that like makes you better, right, than somebody else, which is ridiculous.
Yeah.
So and I have to admit, I totally went into my first pregnancy like with that mindset of like, no, I'm gonna do it natural. I'm not gonna get an epidural. And like at the end of the day, who cares? Like you do you. This is your birth. Things happen for a lot of different reasons. However, your birth happens does not lessen it when compared to somebody else, And so that is very similar to the medication with gestational diabetes of there's like a badge of honor almost when you say, well, I'm diet controlled and like I don't need medication, right? It's like that makes you superior to somebody else with gestational diabetes that needs medication, which is again ridiculous.
Yeah.
So
it's really a challenge for a lot of us, but
yeah. And then at what cost? Like because there's a cost to everything, right? Like a lot of things in life, I would say life, it's not just pregnancy and life, it's like a cost benefits ratio. Like you are deciding for you what is best. And so even if you are, quote unquote, like diet controlled, at what cost? Does this mean you can't eat fruits? Like you haven't eaten fruit at all because that spikes your blood sugar? Well, think of all of the vitamins and minerals that you're now missing from your diet, that you're not getting, baby's not getting.
Yeah, just a lack of fiber and a low carb diet. And then, just that either that damage or that toll that you're going to take on, right, with your mental health when we are maybe restricting or feeling like, I show up to my baby shower and I, can't eat half of what's there. That, that doesn't feel good. So it is something where, it is just kind of weighing the costs and also the risks as well.
Yeah. So when you're counseling women, right, who, let's say, I mean, maybe they've done intuitive eating in the past, or maybe, they just have a history of dieting or whatnot, and all of these feelings are coming up for them. How do you approach that?
Yeah. I mean, a lot of it is, I feel like, reframing a lot of our thoughts that are happening around, thoughts and feelings that are coming up. A lot of people that I work with will be on their way to an intuitive eating journey. And intuitive eating in more recent research has been associated with actually improved blood sugar during pregnancy and postpartum. So I do think that there's still nothing wrong with trying to lean into that like journey with food and things, because if you think about it, depending on where you are with all of that, but say someone does have a good background and has been honoring their hunger and fullness and has made peace with food for the most part. And, they're listening to their body's needs. Oftentimes that's going to kind of guide us in directions that are actually going to support our blood sugar, because skipping meals doesn't support our blood sugar. That's one of the biggest things we talk about, is actually eating every 3 to 4 hours. That feels better in most people's bodies. And that's also that's reflected in someone's blood sugar most of the time. Eating things like, more produce, more fruits and vegetables and whole grains, things with fiber, essentially, and beneficial for blood sugar, but they also help with like digestion and feeling satisfied and full with a meal. Same with protein. So usually these folks are eating more balance, or having more balance with their foods. And again, at the end of the day, that's going to help with blood sugar versus, skipping meals or being more erratic with how we're eating, having our appetite also kind of get out of, I don't want to say out of control, but out of the comfortable zone. If I get hungry, it's not comfortable in my body. I approach the next meal a bit more rushed, and I eat faster, and I probably eat too much and don't feel great after. So, having those skills, again, always comes back to blood sugar usually being more favorable. Same thing with different food choices. So foods that have, less fiber and maybe more added sugars and things, there's definitely a place there that those foods are fine. It's just when they're eaten by themselves, we might not feel great at the end of the meal, or it doesn't sustain us as well. So it might leave us in this like blood sugar roller coaster. And that's going to happen time to time, of course, even, that's fine. It's just, if that was the majority of the time, that's probably not going to lead to great things with blood sugar, but it also doesn't feel great either. So you're kind of working towards similar goals in my mind.
Right. It's just reframing it in a way.
Yeah.
And I also think that with the framework of intuitive eating, it brings the perspective of like post-pregnancy, like, how are you treating your body post-pregnancy? And a lot of women with gestational diabetes are so nervous that this diagnosis now means that they have a higher chance of developing type 2 diabetes later on. And so, what do you do after your pregnancy? And most women are off medication, like once the baby comes, their blood sugars go back to normal, but there's still that fear and that worry of, what can I do? And that, I think intuitive eating really does provide such a great framework for postpartum and really beyond there. So if we can, I think, destigmatize medication, the diagnosis, and then also get support for people, It's like there's such a lack of support. Most women go to Google, they're Googling what to do. And they don't have the support. It can be a hard diagnosis. It can be a lonely diagnosis. And so it's like, how do we support, these women? Because like you said earlier, 8%, it's like 8 to 10% of pregnancies have gestational diabetes. Sure, that may not seem like a lot to you, but that's a lot of people. It's like a lot of people that are dealing with gestational diabetes that I think need to be supported and need to have options around them.
Absolutely. And it doesn't feel like it's built in, right? It's not like
no.
Once you are, deemed, because gestational diabetes does deem you as like a high risk pregnancy, as like blood pressure and I don't know, many other things, but it's not, you're not then provided with like a mental health counselor to like help you manage this. My second pregnancy was high risk, and the anxiety that came with just that label for me was significant. And it took a couple of doctor's appointments and some tears for her to be like, and here's a list of support, which was great when I finally got there, but it feels like it should be there from day one, and that should built in and nothing that you have to seek out, and something that all women have access to.
Mm-hmm.
Same thing with nutrition services. There's a lot of
Yep.
people who go through this diagnosis and might not even see a dietitian once, which just like I can't imagine. I Because that would lead you to Google and just like down this rabbit hole of
Yep.
a lot of unnecessary discomfort, I think. But
Mm-hmm.
anyway, yeah, there are so many things that we could probably do better in this
Yeah. Yeah.
country related to maternal health. And but yeah, I would say if you are in the boat that like some of us are with getting readings back of higher blood sugars in pregnancy, definitely seek that support. Get a dietitian, see a therapist
Mm-hmm.
trained in the perinatal health area around anxiety and things, because it can make a huge difference to feel less alone, and just to give you some skills into getting through the rest of this pregnancy, because it does feel like a long road
Mm-hmm.
when there are so many appointments added to your schedule. I think that's one of the harder things about these diagnoses, is just like towards the end you're seeing a doctor or like having a test like twice a week.
Mm-hmm. Yeah.
It's a lot.
It's a lot, and it's a lot of that, like like we said, the emotional toll of this. Um, so yeah, I definitely think support is big. And so you see gestational diabetes clients one-on-one. Um, so you're licensed in Massachusetts, and then there are some other states that, you know, again, licensure rules, that's a whole nother, that's a whole nother topic. But licensed in Massachusetts and Maryland, and then there are a few handful of states that can also be added on. So you provide one-on-one support to women
Mm-hmm.
with gestational diabetes,
Mm-hmm.
and so if anybody's interested, they can go to our website, haveyourcake.com. It's in the little like bio clicky thing, whatever that's called. Sorry, pregnancy brain. Can't remember these things. Um, and then the other option that we have is the Eat for Two with Gestational Diabetes course, which I love, and we've bottled up all of Nicole's, secret knowledge in all of this, and I think it's just such a great starting point for anybody that has received a gestational diabetes diagnosis, of understanding what it is, what like factors come into play. And I also think it is approachable, with like monetarily, because so much of individual care maybe is out of people's reach financially. So I really think this provides a great inclusivity for people to get access to information.
Mm-hmm.
So that's there as well. And then we also have a free gestational diabetes breakfast resource. So if you are tired of your eggs for breakfast, your plain eggs, you can download this and kind of get some ideas. But yeah, is there anything else you wanted to add?
I don't think so. I think just kind of, if you are someone checking blood sugars and are really feeling distress around it, talk to your providers about what else you could do, because there has
Right.
other options for people who
Mm-hmm.
this is really distressing or is impacting their daily life, which that is a real thing for a lot of people. And there has to
Me.
be a workaround for it. There is
Yeah.
speaking up and having support. Maybe you bring a support person with you to that visit to have this conversation if it feels like a lot. But there has to be accommodations to help you get through this. So maybe
Mm-hmm.
not checking your blood sugar every day. Maybe your partner does it for you and they report the numbers into your provider.
Mm-hmm.
Or maybe that looks like having providers that do blind weights or don't weigh you at all, or really pushing back against any carb counting. If they're suggesting counting carbs,
Mm-hmm.
reading labels, like that's not necessary for for, quote unquote success with this. I think that's kind of the default, in a lot of places. So just know that doesn't have to be what you talk about if that's not supportive to you. But unfortunately, a lot of times we have to speak up and let this be known versus having someone screen for that
Right.
and approach it
Yeah, I think
individually.
that gets into the whole topic of like just advocating for yourself, which is hard to do in a medical setting because the doctor patient relationship is already set up to obviously defaults to the doctor, and we think that whatever they say goes. And like you said, a lot of care is averages, or just like generalizations, but that doesn't actually mean that that's like quote unquote like the right way to do it. Like there really isn't a right way to do most things.
Mm-hmm.
There's multiple ways, and there is a right way for you as an individual, but maybe that differs from somebody else. So I think, like, again, advocating for yourself is just huge. And really destigmatizing your emotional response to these numbers. Because like I said, I did this. I checked my blood sugar for a week, and I had a lot of emotional feelings about this, and there were tears, like, especially when I got some really high numbers. I was like, oh, like I really felt like I was doing something, which again, I wasn't prepared for that whatsoever. I've done a lot of personal work. I'm actually like, this reminds me of like the scale, and there's actually a lot of trauma around the scale for a lot of people. And so I'm doing a weight-free pregnancy. I'm not even doing blind weights. I just am not weighing myself because that has no validity to the health of my pregnancy, the health of me, my current situation. So like, it's just not even there. Right. So I set up that boundary for myself, for this, but I was not thinking about boundaries that I needed for, you know, blood sugar experiment that I was doing. Because anytime I see numbers, of course, my brain starts to, fixate on them.
Mm-hmm.
So it brought me right back to like, oh, it's like you said, pass fail, which is a terrible language.
Mm-hmm.
There is like a, quote unquote, like good and bad. And so like, wow, it is like spiraling me right back into like the scale, seeing weights, and just not a good place. So anyway, I stopped. I got enough to see some trends, and I was like, okay, this is not a positive thing for me, and I'm choosing to stop this, and that is okay.
Yeah. Yeah. And good for you for recognizing that and talking about it, and for coming on here and normalizing it too. I think that's important.
Yeah, I think, so many people, not alone. Nobody's alone. Everybody's got the feelings. So
yes, and pregnancy will do that. It's a true test to all things.
But exactly.
Yeah.
Exactly.
Yeah.
Oh man. Well, thank you so much for chatting about GDM and the stigmas around it. And if anybody wants more support, please, please, please reach out. And you can find us at haveyourcake.com, HALVE, yourcake.com.
Thank you.
So, okay. Bye, Nicole. Talk to you
Bye.
later.